commitment for the hospital started with a group of volunteers and folks in the city here that really felt like there needed to be a hospital between Dallas and Fort Worth that could care for people who lived in this geography. They went door to door and pushed hard to raise the money and get the commitment for the land to be able to raise a hospital here.
In the decade from 1950 to 1960, Irving was the fastest growing city percentage-wise in the state of Texas and the 10th fastest growing city in the United States. And we were thinking, of course, not of do we need a hospital today. The Irving City Council appointed a committee of 11 of us. The committee formed what is called the Irving Hospital Authority. We had to find a way to raise the funds to build a hospital without taxation. Building that first hospital, which was called the Irving Community Hospital, took 4 years. And it was a great project. I think I mentioned how it pulled the whole city together. Everybody was behind it.
As a community grows and as the community ages, there are other needs for a hospital. We recruited cardiologists in the mid-'80s. We then recruited cardiovascular surgeons, and from there we started taking care of very ill patients, and we've continued that through the next 25 years.
My personal experience with taking care of patients from here starting in 1979 has been incredibly gratifying from the point of view of not only being able to pretty much have everything I wanted here to take care of them. So if there was any device, anything new in cardiology, I never had a problem, regardless of the cost, of getting the technology.
There are a number of milestones in the rich, robust history of Baylor Irving. Some of those would include the creation of the Charles A. Sammons Cancer Program over 20 years ago that continues to this day to take care of cancer patients in our community. Most recently, we've been expanding the emergency department. That's been a big milestone for the organization. As we care for more than 70,000 patients in our emergency department every year, we've needed to expand that to meet both the changing technology needs as well as the growth of our community.
Our theory here is that loved one in the bed, you need to pretend it's the one that you love the most, that is your best friend, and what would you like their care to look like? And that's what everybody in this building is focused toward, is what does that patient need, and what would I do if that was my loved one? And it makes the decisions pretty easy.
The thing that I appreciate the most is that everybody in Irving still considers this their community hospital and their place to go and their place where they're comfortable and where they know they're going to get good treatment.
Philanthropy really speaks to the heart of giving and the heart of the community's commitment to an organization. We have had a robust relationship with the Irving Healthcare Foundation for many, many years and are very proud of that rich history. When people give of their time and their energy and their talent and their money, it's really a tribute to their recognition that what we do meets the needs in this community. So philanthropy allows us to take each and every precious dollar and put it into program and into services for our community.
One of the things that's different here than in most any other place that I've been is the attachment that the people in this community feel toward this hospital. I think it started that way and it's been perpetuated. I think that the foundation has been very important in doing that. But I think that the physicians, our employees, and our management has always been a part of the community, and the community feels a part of them.
Passion is something you'll find in the people here at Baylor Irving. The folks who work here, they live in our communities. So our commitment to making sure that we're doing the very best for our patient means we're doing the very best for ourselves and for our family. So that passion about caring for the community is alive and well in Baylor Irving each and every day.